COVID is just one of the many reasons there is a mass exodus of nurses leaving hospital jobs. During recent protests here, nurses complained about unsafe provider-to-patient staffing ratios and inadequate compensation. Healthcare professionals tell the I-Team it's going to be a challenge to replenish this workforce.
Because right now the burnout is real.
Growing access to health care, an aging baby boom population, and more people suffering from chronic conditions are all contributing to an increased demand for nurses, according to the American Nurses Association. And of course, there's the impact of the pandemic.
I thought I was going to die. I thought I was going to die every day.
Family nurse practitioner Keisha House contracted COVID in March of 2020, missing 4 months of work and school.
I think all nurses should be well paid, well over what we are receiving. We go over and beyond every single day.
Records reveal there are nearly 4.5 million registered nurses with active licenses. The U.S. Bureau of Labor Statistics says of those, only 72% are employed as RNs.
Staffing for nurses has been an issue for many years. We know that 1 in 5 healthcare workers left the healthcare profession during the pandemic. So add that to the fact that we have over 50% of our registered nurses who are over 55. We've got a real problem ahead of us if we don't entice and encourage more student learners to come into the nursing profession.
The I-Team met Adam Soleil and Lance Orpila in April as they were finishing up their nursing degrees at UIC. They both credit this simulation lab with preparing them for their first jobs as registered nurses.
I'm able to become much more comfortable at the hospital.
It gives you that real-life experience.
As students, both said they worried about the challenges facing the workforce.
I definitely do feel like we need to treat nurses better. We need to provide better resources, just like mental health, pay, staffing ratios.
The role I play in the healthcare field is actually much more important than I originally anticipated.
So we see that a lot of these days, a lot of nurses have been leaving from their staff roles and then becoming travel nurses. And a lot of that is because of the increased pay.
We need more amenities. We need more retail, more restaurants, more green space, a place where they can go and relax when they're on break or after work.
Illinois recently amended its Nurse Agency Licensing Act to further protect nurses' rights.
It definitely benefits the nurses in that any rate that's negotiated between a health facility and a nurse staffing agency, 100% of that rate has to go to the nurse.
Apparently, that wasn't happening during the pandemic. In the Illinois Medical District, 70% of the nursing faculty is older than age 55. Despite the aging faculty nationwide, the number of nursing school grads has grown tremendously in the past 2 decades.
We are students that grew up in a pandemic, and I feel like we're all motivated than ever to join the force and help in whatever way we can.
All across the country, hospitals are in desperate need of registered nurses. A recent survey revealing a quarter of the participating hospitals have at least 100 nurse positions currently open. They are counting on recent grads and travel nurses to fill some of the gap.
Hey, if you like that video, be sure to subscribe to our ABC7 Chicago YouTube channel.